Good day. Before we start off, let me introduce myself. My name is Heng Ying from Xiamen University, Malaysia, School of Computing and Data Science. My team member includes Loong, Dr. Burra, and other mentors. In this video, I will be giving you a brief idea about our project, the real-time system for anesthesia dosage to surgical patients using big data analytics. So, what's come to your mind first when I mention the word anesthesia? Is it something that usually appears in hospital or dental clinic? That's true. Anesthesia is a medical treatment that is injected into patient to reduce the pain or to keep the pain away before surgery is conducted. Apparently, medication errors can still happen. For example, providing incorrect medication dose or administration rates of drugs. The next problem is the dose recommended for an anesthetic to be used usually is much higher than the necessary dose for a local anesthesia. Hence, this leads us to the objective of our project. Basically, we will be focusing on the various factors like age, gender, and blood pressure that impacts the dosage most. Apart from that, we are going to design an Anesthesia Dosage Recommendation System, which is known as ADRS, that utilizes big data to recommend anesthesia dose. Next, we'll also design a GUI dashboard to display real-time data and to ensure a higher accuracy of the data-driven decision. The proposed framework takes in several input variables, which is age, gender, weight and height, and also heart rate, etc. After the doctor enters the variables into the system shall process the data and compare it with the data set from the big data, and this provides suggestions for doctors on dosage with high accuracy in the real time. You may wonder, what is the quality of being new and special in our project? As mentioned, our project aims to provide a more accurate anesthetic dose based on the real-time big data analytics system to assist the doctor but not to replace them, so that they could improve the performance of anesthetic applied to the patient. Besides, we introduced a very systematic, modernized, and user-friendly system on suggesting the dosage of anesthesia by the provision of data-driven decision. In this project, we will utilize big data by using Hadoop and Python to help in analyzing the data and deciding the dosage for each patient. A GUI, a graphical user interface, will be designed to present the outcome of the data and recommend anesthesia dosage in the real time. Furthermore, I would divide the benefit for the intended user into two groups, which are the patient and the doctors. Since the patient are the direct user who need the aids of anesthesia, therefore, we need to ensure a secure and reliable environment for them. Hence, using our system, it could minimize the risk of side effects caused by any medication errors. Secondly, the doctor and hospitals. This will enhance their credibility and reputation of them by having a high flexibility measurement of medical drugs. Next, we will move on to the commercialization potential. Digitalized gap in Malaysia healthcare sector. Currently, there is no existing integration system for processing patient information. We could also propagate the anesthesia knowledge in a more general way so that the non-specialists can clearly understand the need for having such amount of dose before any surgical operation. Also, we should promote the importance of collecting anesthesia dataset in a systematic manner. As a recap for today, the real-time system for anesthesia dosage will recommend to all of the patients, no matter if it is a minor or a long operation. By using big data analytics, it could also minimize any medication errors as well. Alright, that brings us to the end of today's presentation. Thank you and have a nice day.